Good day. My name is Herman Thomas. I am an RN paramedic with the local Emergency Services Board, and today I'm going to be giving a little talk on tourniquets. You come upon a person and bright red blood is gushing from a wound is more than a little frightening. It is fairly common that a great deal of blood loss can quickly lead to a loss of a person's life. And the situation is not addressed quickly, people can sometimes die before emergency help can get to the scene. In fact, most people aren't quite sure how to stop a lot of bleeding and are likely to focus on the call for medical assistance. However, before the area begins to look like some crime scene, there's something that can be done: a simple use of a tourniquet. When it comes to wound care, there are several processes that can be used to properly attend to a medical issue, depending on its severity, and a tourniquet is one of the best options for a bleeding situation. In fact, research suggests that tourniquets can save lives of extremity trauma patients because of the reduction in blood loss and are a safe, effective tool to use. Among the things that people may not realize about tourniquets is that they're in fact safe for application by civilians. In the military side, we've used them for years. Moreover, this is a life-saving method that can allow rescue personnel, once they show up on the scene, to switch their attention to elsewhere on the injured party, as mentioned by Dr. Doyle in a 2010 issue of the Journal of Emergency Medical Services online. Understanding why tourniquets are used and how they might benefit is not only for the medical community, but anyone trying to provide assistance at the time of a crisis. In fact, it can prove life-saving. Civilian use of tourniquets hasn't really been common. This is in fact because for a long time people assumed they were improperly applying them and they could damage the person in the extremity or damage their body and cause long-lasting damage to patients, as mentioned in the Mayo Clinic online article in their website in this year, 2016. The use of this method as a means of patient care was discouraged because most doctors thought without proper training it was felt to do more harm than good. But because of this, many don't know that this is even an option when someone is bleeding to the point where it becomes life-threatening. However, evidence shows that significant blood loss in a wounded individual is far more detrimental to their health than an improperly applied tourniquet, as Dr. Doyle states again in his 2010 article in the Journal of Emergency Medical Services online. In fact, the tourniquet use usually spans a short time until medical personnel can get there, and even if it hasn't been properly applied, it can slow the flow of bleeding enough that we can treat it further when emergency medical services people arrive. And it is also shown that while damage may occur if you improperly place a tourniquet, it's likely this damage can be reversed. Unlike major blood loss, cannot be reversed, and the impact is often fatal to the individual. In most emergency situations, a tourniquet is not going to be longer than 20 minutes applied, so the emergency services personnel can get there, get to the scene, and take them to the hospital. This reason, it's simply too easy to use this and too easy to stop the flow or lessen the flow of bleeding for these injured individuals. Therefore, it's a technique that even untrained medical people, lay people, bystanders, first aid responders can use for a short-term solution. And also, it can be when emergency medical service personnel do arrive, they can loosen it and properly apply it if it hasn't been properly applied. The only difference between civilians and medical professionals is that we receive a little extra training. Civilians can properly apply a tourniquet if they put their mind to it. So there are very few reasons not to apply a tourniquet at all. In fact, I can't think of a good reason not to apply a tourniquet. An additional point about a tourniquet is the use, in fact, that more often than not, a patient bleeding to the point of needing a tourniquet is often in significant distress. Other parts of their body are being compromised. As such, it is helpful for us medical personnel if the bystander, lay responder, or first aid person has already attempted to stop the bleeding. And with a tourniquet, it can usually slow it down. As mentioned again in Doyle's article, Journal of Emergency Medical Services 2010, and also by Dr. Sipple in EMS World 2011 online in September. The application of a tourniquet will help medical personnel attend to other injuries, which can be also just as life-threatening once the bleeding has been stopped. It can also save us time to save this person's life. More often than not, stopping the bleeding will save us 5 or 10 minutes by the time the emergency responder gets there to actually get the person to where they need to be and attend to other life-threatening issues. In fact, most tourniquets can be applied with something that you can find on you, a belt, a simple handkerchief, and something hard, or a commercially applied tourniquet just can be found in some areas where AEDs can be found. And it can be applied in less than 60 seconds, which is also mentioned by Dr. Sipple in his EMS World Online in September of 2011. This means emergency medical personnel have a significant amount of time left over to save the person. As before, research suggests that tourniquets can save the lives of extremity trauma patients because of the reduction in blood loss and are a safe, effective tool. And as such, civilians are capable of applying tourniquets to the benefit of the patient more often than not. And this method will prove to be life-saving in many instances. Medical professionals utilize it, are freed up to attend to other aspects of patient care, and the outcome is vastly improved for the patient. This is why it's important to allow education to guide anyone that is interested in using this simple means for potentially saving someone else's life. Knowing how to apply a tourniquet, and in most situations, is really appropriate and is extremely important. The bottom line for tourniquets is they save more lives than not. When someone is literally bleeding out on the floor, a tourniquet means the difference between life and death, and a medical professional needn't be the only one that is able to effectively apply a tourniquet. Gain education in how they work, so that even as a layperson, a first aid responder, you can do the first step in saving somebody with major bleeding. And to illustrate this, I have pulled something from a PowerPoint by Dr. Holly in New Zealand from his PowerPoint War, What Is It Good For?, which was published in September 2013. This particular slide shows that when applied in ED, only 13% of people are saved. But when applied pre-hospital by lay responders or first aid training people, 80% of people in shock and 92% of people in heavy bleeding are saved. And that is a statistic we can't ignore, and we have to put that knowledge out about using tourniquets first, where they're a valuable, valuable asset in saving someone's life. Thank you.